All right. Hello, everyone. Welcome back to the meeting. As we mentioned, we have a guest speaker. So Harpreet here. She's from the Sports Medicine Club at UC Davis, and they have some general meetings to give info about assessing musculoskeletal injuries and rehab. So she's here to give a little presentation about it. There'll be questions at the end as well.
Awesome. I'm good to go. Okay, cool. Oh God, gosh, that's sweet. Okay. So, hi everybody. As mentioned, my name is Harpreet. I'm the president of the UC Davis Sports Medicine Club. And first of all, I just want to say that I'm really excited to be here and talk to you guys today. So I hope you guys can take away something helpful or useful from this presentation. So today we're going to be talking about the different types of injury that you typically see, as well as tissue response. So, okay. Before we do begin this, I just want to say that be careful how you use this information, right? Just don't diagnose and treat people that you shouldn't be diagnosing or treating. It'll become an issue. So obviously, if anyone comes to you with serious concerns, go refer them to some sort of physician or any sort of healthcare provider. So, yes, okay. Okay, so first, I'm going to start off by explaining to you guys the different types of injury that you typically get. I just think that this is like a great introductory topic for sports medicine, just because it helps us establish good terminology when we're communicating with other healthcare providers, as well as just kind of helps categorize the different kinds of injuries that we typically see. Okay. So the first kind of injury that we see, I'm going to use this pointer actually. So the first kind of injury that we typically encounter, and this is what people generally think of when they hear the word injury, is what we call macrotrauma or acute injuries, right? And so macrotrauma or acute injuries, those terms are interchangeable. They result from a single traumatic forceful blow or event. So this means that something happens that causes an injury. So generally, any sort of macrotrauma or acute injury will have some sort of mechanism of the injury. So there's going to be a moment in time where you didn't have the injury, and then something will happen, and then the next second you will have that injury. So that's what a macrotrauma or acute injury is. So now the common types of macrotrauma injuries that we typically get are sprains and strains. And so I wanted to kind of throw these terms on there just because I know that people tend to kind of confuse the two a lot. So I thought it was really important to distinguish between those two. So sprain, so both sprain and strain actually both refer to some sort of tear or rip in some sort of tissue, but they differ because they're talking about different tissues, right? So sprain is talking about a partial or complete disruption of the fibers within a ligament. Okay, now what's a ligament? If you don't know what a ligament is, that's totally cool. That's why I have put these pictures up here. So a ligament is a tissue structure that connects bone to bone. So you can see here, there's a bunch of ligaments that's connecting this bone, the femur, to the ilium, which is, in your hip. So that's what a ligament does. So sprain refers to ligament, any sort of disruption of the fibers within a ligament. Strain, on the other hand, also means a tear or a rip in the muscle itself. This refers to a tear, but this specifically refers to a muscle, as well as any kind of tissues that are related to the muscle. So a lot of these tissues include fascia or as well as the tendon. So for those of you guys that don't know, fascia is basically like this kind of thin layer that goes around your muscles. It kind of keeps them compact. So any sorts of tear to your fascia is also considered a strain. And then if you're not sure what a tendon is, a tendon connects muscle to bone. And so in this image, you can see that we have this muscle and this bone, and the thing that's connecting the two together is a tendon, right? So sprain, ligament, strain is muscle. Okay, so both sprains and strains have 3 degrees. So you can have a 1st degree sprain, 2nd degree sprain, 3rd degree sprain, as well as the strain, right? Each degree just gets worse as you go along until you get to the 3rd degree, where the 3rd degree means like a complete rupture, right? So if you like completely tore through a tendon, that would be called a strain. Okay, so that's what a macrotrauma or acute injury is, right? So single traumatic forceful blow. The next one that we have, people don't really think about this when we say the word injury, but is microtrauma, right? So microtrauma is a chronic injury or inflammation. So how microtrauma injuries work is they will develop over time, and they're due to some sort of repetitive trauma to the tissue. So typically, for example, let's say you have a baseball player. The baseball player is not throwing, his throwing form is not correct, right? He uses that throwing form for a few weeks, even months. That's eventually going to cause some like degeneration of like tissue to occur, which is going to lead to a chronic injury, right? So with acute injury, we saw that something caused an immediate injury. With microtrauma, it slowly builds over time. And then just kind of like a little trick for you, something that I use. So any term that ends with itis or osis generally means like a microtrauma injury. So itis just basically, both itis and osis just mean inflammation of. So for example, tendinitis means inflammation of the tendon. And we just talked about what a tendon was, right? It connects bone to muscle. So tendinosis, so osis also means inflammation of, but it just refers to like a worse or even more chronic version of inflammation. So yes. Also, if you have any questions, please feel free to send them in the chat. I will try to look at them as I go along. Okay, and so here in the slide, I kind of just put together this information just so you can directly compare the two. So macrotrauma or acute injury, again, results from a single traumatic forceful blow or event, and it will always be associated with some sort of mechanism of injury. Something must have happened to cause that injury directly, right? Microtrauma, on the other hand, is a chronic injury or inflammation that's generally caused by some sort of repetitive trauma. Okay, so that should kind of cover like the basics of the different types of injuries you see. So we have these two categories of like microtrauma and then macrotrauma, and they mean different things. And yes, the question in the chat, can microtrauma lead to macrotrauma? Yes. So for example, if you guys know Klay Thompson, right? He recently just got an Achilles, he tore his Achilles. And so with that, I was actually talking to some people about it. Generally, if you have inflammation in a specific tendon and you cause some sort of like motion, that can directly lead to like an acute injury, like a macrotrauma. So I would hypothesize that could have been what happened to Klay, that maybe his Achilles wasn't as flexible or as it needed to be, which caused his tear. So that's just one example. But yes, that was a long answer to that question, but yes. Okay, so the next thing we're going to go into is what is known as tissue response. And so I think generally when people are introduced to like the field of sports medicine or physical therapy, I think people really immediately want to go into kind of learning about like, what is it, like rehab programs, how to assess for injuries, design rehab plans, all great things, all important things. But I think before we can actually even start talking about that stuff, it's really important to understand what's going on in the tissue. So that way we can understand what's going on and then address those things. So that way those rehab plans will start to make more sense to us, right? Okay, so the tissue response is broken up into 3 different phases. And what we're gonna do is we're gonna go into each of those phases today. So there's the acute inflammatory phase, there's a proliferation phase, and then there's maturation at the very end. Okay, so now we're just gonna go into each of them and kind of break them down into a little bit more detail. Okay, so the first phase of any injury will be the acute inflammatory phase. So this is the phase that kickstarts the healing process. And so generally during the acute inflammatory phase, aka like given its name, the inflammatory response is occurring. So what is the inflammatory response, right? So basically how it goes, first you have an injury that's going to cause some sort of tissue damage. That damaged tissue then is going to release some sort of chemicals, and then as a result, blood vessels are going to dilate, they're going to widen to increase blood flow to the injured area. Now, it's kind of, I guess, we can't really assess what's happening at the molecular level just by looking at like a foot per se, right? So some symptoms of the inflammatory response is we can feel a lot of heat coming from the injured joint. There's a lot of bleeding, and generally it'll be like a lot of internal bleeding. So you can see a lot of like bruising or what we call ecchymosis. You'll see swelling, you'll see pain, you'll see redness, and there's going to be loss of function. And so when you see symptoms like that, that's an indication to you that you're in the acute inflammatory phase, right? And this phase lasts about like approximately 3 days. Okay, and then I just wanted to throw this fun fact in there because I thought it was pretty cool. I think that when I think people associate swelling with something bad, but swelling is actually good. Why, like it's good because it helps to stabilize an injury, right? So I don't know if any of you have ever like sprained your ankle or something, right? You'll notice that if you like sprain your ankle, it's swollen, you can't move it. And it might be kind of uncomfortable of a sensation, but it's good because if you were able to move that joint, that might cause further damage to the sprained ligament or any other tissues in the area. So swelling is good. When we see swelling, that's a good sign. We just want to be able to control that swelling and help kind of promote it in the right way. So yes. Okay, yeah. So with the ice, there's actually, I'm not 100% sure what the theory behind ice is. Um, there's actually been research that shows that icing isn't really that good for you. We generally use ice to what is it like to help with the pain. But the idea here is also when we take care of our athletes in the internship portion, not the club portion, but it's also up to the patient because you know there is that mental aspect to it, and like a lot of athletes will feel more comfortable if they have ice. And then what was it? Yeah, and again, we just want to be able to control the swelling. So swelling is good, but that doesn't mean that we're just going to let it sit there. We're going to actually control it, and I'll go into that part of it a little later in the presentation. Good question though. um, okay, so what else is going on? So at the molecular level, I have not memorized this information. I don't think you should either. Just try to understand what's going on. So generally phagocytes, which you know are part of the immune system, migrate to the area and wall off damage, and then granulation also occurs. So let's talk about what those two terms mean, right? So phagocytes are basically cells that protect the body by ingesting any sort of harmful foreign particles, bacteria, and dead or dying cells. So they're part of the immune system response. I think of them as like little Pac-Man, right? They're just kind of collecting some sort of garbage. Then we also have granulation, right, which new connective tissue and microscopic blood vessels that form on the surfaces of a wound during the healing process. So, you know, we're getting some more nutrients to the area to kind of help promote the healing. And so a lot of what's going on in the acute inflammatory phase is, you know, it's just the immediate response to the injury. And the primary goal of the acute inflammatory phase is, hey, let's clean up the garbage let's clean up all the dead tissue that's there. Okay. So before we go into proliferation, I'm going to actually talk about this transition from acute to proliferation because it's pretty important. So at the molecular level, macrophages and fibrogen are present, and then coagulation begins to occur. So macrophages are basically certain blood cells that can digest any sort of foreign particles or damaged tissue. Fibrogen, what it does, it kind of walls off the injury and traps any sort of damage there. And then coagulation, blood clots to form solid masses, right? We don't want any more sort of bleeding. Additionally, another thing about this kind of transition period is that, you know, you have a lot of trapped blood cells and exudate in that location. And exudate basically just means like massive cells that like have escaped the blood vessels. And those need to be removed, right? We can't have, I guess, like dead tissue lying around in an area. We need to be able to clean that up. And so this is kind of where the lymph system comes in. The lymph system is basically a garbage collector, and I'm gonna talk like very, very briefly about like how to promote the lymph system from like to pick up that garbage. But yes, so there's that transition phase. Okay, so the next is proliferation. I did not have a good picture of proliferation, so I hope you enjoy our mascot, Finrock. So proliferation can last anywhere from about 1 to 10 days. And what's important about this proliferation phase is it's like this race between repair and regeneration, right? And so we okay, those two may sound kind of similar, but they're actually very different things. So what happens is repair will result in scarring. So I like to think of this as, so let's say you have a structure. All right, let's say that this is my hamstring muscle. I've torn it here, right? So, you know, there's like this gap here. When we're talking about repair, imagine like taking just a glob of glue and just kind of plopping it down in that area, right? Like it may cover up that scar, that tear, right? But it's not going to be smooth. We're just going to get this pile of kind of dried up glue over that area, right? So if you have an athlete that comes in with a hamstring strain, right, and let's say it doesn't properly heal, what's going to happen is they're going to develop scar tissue, and you can imagine that over time this is going to result in an inflexible hamstring, which is going to make them being an athlete so much harder. Also, it's going to make them more prone to hamstring strains, right? So what we want instead is we want regeneration. We want to replace the original material completely, and make sure that we get this sort of smooth healing over that torn area. And so that's kind of the primary goal of proliferation. So the proliferation is a really important phase because you're going to dictate whether you're going to get scarring or the replacement of original tissue. So it's really important to like intervene and kind of help the individual out in this phase for sure. And so also molecular level, for those of you guys that are interested, so fibroblasts, they increase, they start to basically lay down the structure for the rebuilding of damaged and dead tissue. And so generally with proliferation, you're starting to kind of get into that healing process again. So you're basically fixing your healing and stuff, right? And so additionally, your blood vessels also start to repair here, so that's good. And so this entire phase, proliferation can last about 1 to 10 days. Of course, it's going to depend on the injury that you have. Okay. Okay, this, again, enjoy this picture of gun rock, right? And so this leads us to this last phase of the tissue response. And this last phase is called maturation. So I didn't really put a time frame on this maturation phase because it's really going to vary depending on what injury you have. I couldn't really find a number on this one. So basically maturation, I think of it as kind of like tying the bow on the gift, right? You're really just kind of making it look pretty. You're making it good. So basically maturation, you're cleaning up and solidifying the healing process, right? So I like to think of it as this way. So once your tissue has completely healed, right? That tissue is really soft, right? And so if you're a Division I athlete, you can't jump right back into practice with that like ligament because it's too soft, right? So we need to kind of enhance that enhance the torn tissue or the injured tissue with more solid and long-term tissue, right? So if that didn't really make sense to you, I think of this as like sunburned skin. So if any of you guys have like ever gotten sunburned skin, you'll notice that like after your like burnt skin peels away, the new skin that's like fresh that's underneath, it's really fresh, right? It's like the skin on a baby basically. So the skin basically needs to mature before it can actually withstand some sort of environmental conditions. So generally exercise in this maturation phase would build endurance. And so actually in the maturation phase, when we have athletes, we typically allow athletes to start going into more sports specific drills here, where we're retraining their body to basically be able to adopt to their sport, right? Because we want to make sure that the athlete just doesn't heal, but they can actually go back to those practices, go back to those Division I level games. Okay, so this is an image of what a typical healing tissue response looks like. So there are just some things I want to kind of point out. Obviously, between each of those phases, the time is pretty variable. You can see that remodeling can even take up to 2 years. So like I was kind of mentioning with Clay Thompson, his injury like rehab program is going to take at least a year, about a year. So obviously it's going to vary a lot with what kind of injury you have. And then something else that I really wanted to point out that's important is it's not just inflammation, proliferation, and remodeling, you know, there's this overlap between those phases, right? So inflammation and proliferation, those will overlap, and then proliferation and remodeling will also overlap, okay? So that's kind of important to know and important to kind of point out here. Okay. And so this is a textbook image, I think that one of the athletic trainers showed us that kind of shows this response. I tried my hardest to find like a video or something, but they were just all terrible. So basically, I would say that you can see that this is, you know, this tissue is healing over time. So like these first two images would be kind of like the acute inflammatory phase. You see a lot of kind of like dead tissue. a lot of it kind of needs to be cleaned up. And day 5 is kind of when you're going into that transition period between the acute to proliferation. So there's still some stuff to clean up, but you're kind of starting to heal the tissues. You can kind of see this. And then day 7 to 14, right? Really, depends again on the injury, but this could be something like proliferation. And then day 14 onwards up until day 21 could be like maturation and working on building endurance. So this is kind of like in a cartoon style what it would look like. So you can imagine, so actually now that I have this image here, you can imagine that in the proliferation phase, right, you obviously want regeneration to occur. You want these structures to connect well because it'll be smooth. So you can imagine if you kind of just glopped down like a bunch of glue there, it would make that tissue like a lot more inflexible, which could be, which would be an issue for future cases. Okay. Okay, so now that we covered the basics of tissue response, right, we can actually talk about developing rehabilitation programs. So how we have designed our rehab program is at least at Davis, right? For the athletes, typically what we do is we've taken a look at the tissue response, what's going on, and these phases kind of address different parts of that tissue response to help each of those phases in the tissue response do the best it can do, right? And so we generally break it up into about 5 phases. Different schools will have different rehab programs, but this is the one that we have, and this is the one that we use. So phase 1, okay, in the phase 1, we're attempting to control the inflammatory response. So I guess the question was asked earlier, this is typically where you're like ice people's joints. So this is, inflammatory response, cell death, inflammation, hemorrhage, pain, spasm. So I think in this phase, we typically try to control some of the pain that the athletes are feeling. So we can use like electrical stimulation. And so for those of you guys that don't know, electrical stimulation is basically like this tool that we use to kind of, it actually doesn't help promote the healing whatsoever. But it distracts your brain and basically puts in a different kinds of sensory input in the location that the athlete feels pain. So then the athlete like temporarily forgets about that pain, if that makes sense. So that's a great one for this phase. We also typically do, icing, right? Helps with pain as well. And then I think, and then on to phase 2, right? This is where we really begin to reduce the swelling and kind of beginning that proliferation process, right? So we want regeneration, not repair. And so remember how earlier I was kind of talking about that transition period between the acute inflammatory phase to the proliferation phase? And we were talking about the lymphatic system and how it's kind of important to help stimulate that. So generally what we do to kind of help stimulate the lymphatic system is generally when injuries have like a lot of swelling, we'll do effleurage, which is like this massage technique, if you kind of think of it, but not really. Basically what we do is any sort of like fluid, we try to push that fluid towards the heart to like stimulate the lymphatic system to collect it. To minimize scarring of the tissue. No, yeah, so there is a way to minimize scarring of the tissue. It really just depends on what sorts of rehab exercises you do. I know that there's one thing in particular that our athletic trainers do. We're not certified to do this because you actually need to be like certified. Is this tool we call Graston? It's actually really cool. It's like this kind of like this metal scraping tool. And what it does is it like smooths the tissue. And so sometimes what athletic trainers will do is if they notice that there's some scar tissue building up, not that I would know how to notice that. They're just good at what they do, right? If they notice that, what they can do with the Graston is they can actually go against like the flow of your tissue fibers or like the way that your tissue fibers like line up. So like let's say for my wrist and forearm, it lines up this way and I have scar tissue. I'm building up here with the Graston. They can break up the scar tissue, right? Re-stimulate the inflammatory response so we can kind of go back in time a little bit. And then with the Graston, when I'm healing in that proliferation phase, they're going to really work on smoothing that tissue out to like minimize that scar tissue. It also depends on what kinds of injuries you're doing, or not injuries, what kinds of exercises you're doing, which is also why balance is important here. So typically in phase 2, we start helping athletes, especially if it's like an ankle injury or whatnot, typically starting to engage with that joint again. So we'll have like an athlete, let's say like standing on both feet and like asking them to shift the weight between both of their feet. Or we'll ask them if it's an ankle injury, right? We'll ask them, hey, can you stand on the ground? Can you just stand on the ground on one foot, right? So that's the phase two, and that's kind of how we ensure that we get regeneration, not repair. I'm not exactly sure how it works on the molecular level, like why doing these particular exercises is going to lead to regeneration. I just, from experience or from learning, just from being in the training room, this is kind of some stuff that I've noticed. So then we have phase three. So phase three actually tends to be the longest phase. So we continue into proliferation, and we can even kind of dip into that maturation phase. And so at this point, we're going to really work on cleaning up and solidifying the healing process. So like we said, proliferation and maturation, right? Maturation, we're really working on building that strength and muscular endurance. So typically we want the athletes to be able to work longer for the length of a game or a regular practice, right? We can't just let them go back to their sport once it's like healed. We need to make sure that they can do what they're supposed to be able to do before we give them the okay to go back, right? So like, for example, if you're a cross country runner and you tear your ACL, right? Like it'll be okay. Like you can probably go jump back in sooner because you're not doing a lot of that cross cut motion that let's say if a basketball player got an ACL tear, right? So for a basketball player, we would have to retrain them to be able to do that like cross cut motion again with their ACL tear. So some typical exercises you can do here. So like, let's say you're working with the balance thing again, right? This time you can add like some sort of unstable surface and say, hey, now balance on this, right? If it's like a shoulder injury, right? You can start being like, hey, let's move up a little bit. Let's work on doing exercises at a more unstable position for your shoulder. Okay, and so then the last phase here that we have is phase 4 and phase 5. So phase 4 and phase 5, like that is basically entirely about getting the athlete back into the sport. Typically, sometimes like athletes won't even finish phase 5, but we'll allow them to go back into their sport. So so during this time, we have the athlete do like a lot of sports specific drills. So if they're a basketball player, we'll reintroduce basketball for them, have them do some drills with that, because we need to make sure, again, I really want to emphasize this is they need to be able to do what they were doing before, right? It might be different with the normal population because the normal population isn't, competing at a Division I level, right? Or even competing, right? If they're not physically active. That's why sometimes if you have like, for example, my personal case, right? I have a lot of shoulder issues. It's not a big bother for me because I don't compete at the level where my shoulders need to be 100% okay, right? But with our athletes, they do need to be able to do that, right? Because those are the motions that they're going to be doing typically. So generally, yeah. So we'll be doing sport specific drills here. We'll be completely at this point, definitely 100% weight bearing on whatever sort of joint that was injured before. And it's also kind of like this mental aspect to it. I think just in my previous experiences when I've been injured in the past, when I was a high school athlete, the rehabilitation program can actually be quite lengthy for some athletes. And it can be very like mentally draining, even not even just for athletes, but for like a lot of people, right? So with athletes, what we do is we kind of also want to throw in like basketball drills and baseball drills and things like that, because we want to help the athlete, kind of see the end in sight a little better, be like, okay, like, yeah, I'm working with the basketball again, like this should be good. So yeah, this is how the phases of rehabilitation work. Okay, yeah, that went way quicker than I thought it was. So please send me questions on that. I guess I'll just give you guys some information about our club. Let's see, let's answer. Oh, yes. Um, yeah, so basically, we meet every Thursdays from 7:10 to 8 p.m. So yeah, if you enjoy this, please consider like checking out our club. We talk a lot about this. We talk about like things like clinical evaluations, how to assess injuries, designing rehab programs for injuries, really like anything that like anyone's interested in. We just recently had a presentation on like looking at famous athlete injuries, really taking a moment to kind of look at like what happened to those athletes, how the rehab programs are going to go, things like that. If you can't make those Thursday nights, we do have like this system where if you're still interested in seeing our slides and kind of like making up meetings, you can actually give us your email. We can put you on the email list. Oh, Lily, you're here. Perfect. Yes, the form that Lily just sent, you can go ahead and fill that out. And we will put you on our email list so you still get like information about all of our weekly meetings, or if you want to like look at any of our slides, if you missed a meeting, things like that. Yes, so please fill it out if you're interested. Add us on the gram, at UCD underscore sport or SMSIP. And or if you want to, you can go ahead and email the sports medicine email. I will also send my email in the chat, my personal email, if you guys just feel like you want to email me. What is it? Did I spell that right? I always like triple check. Yeah. Okay, cool. Yes, so please, any questions? That went by so much faster than I anticipated it would go. So please ask me questions. Yeah, of course. I'm glad you found this informative. Oh, y'all are so sweet. Oh, I guess I'll stop sharing, I was like, there's really no point. Yes, of course. So, oh my God, there's like 80 of you guys here. It's a good thing I started like sharing my screen earlier before I like freaked myself out. I'm glad you guys enjoyed it. Thank you. Oh my God. So, any questions whatsoever? Lily, I'm not going to answer you. Cool. I mean, yeah, I guess if there's no questions, yes. If there's no more questions, I guess you guys can take it from here. Oh, yes. Okay. Sorry, did somebody say something?
Oh, I was just going to say, I think you have a question in the chat.
Oh, yeah. Okay, perfect. I literally just saw it. Yeah, so out of curiosity, does rehabilitation also consider mental health? Yeah, I would hope so. So a lot of the things about our athletic trainers is that they're really great. One of the reasons why I personally love sports medicine so much is because you get to establish like a really close relationship with all your athletes. You're with this set of patients for years, basically, right? And so you get to know them a lot. This is why sports medicine is great. So if you're interested in like having sort of a patient interaction where you're like really familiar with the patient, sports medicine is a great field for you. But I think most of our athletic trainers really like work on not only helping the athlete physically but mentally. They obviously they care for those athletes because they've known them for a while. But this is why we also sometimes do things just to make the athlete feel better. So for example, like a classic thing is KT tape, right? There's a lot of research about like it works, it doesn't work. Some athletic trainers swear by it. Some athletic trainers completely hate it, right? But what our athletic trainers do is something with like KT tape is they kind of leave it up to the athlete. And I think what a lot of people don't realize about sports medicine or just kind of any like healthcare position is it's a lot about like feedback. You're really communicating with the patient, like, hey, does this feel okay? Like, is this what you wanted? Or should we switch it up? Let's try something different. That'll help you. So I would hope so. Yeah, so sports medicine, it's a bit complicated. We do have this kind of internship aspect to sports medicine. Unfortunately, that internship aspect isn't happening right now. So with the internship, what we do is we actually get one-on-one patient interaction with the athletes. It's been great experience for me. You actually get to put your hands on the athletes and help them with their rehab plans and learn from the athletic trainers and the team physician directly. But that, again, that's not happening because, COVID, right? And so this is why we've never had this club format before. So now we have developed it into like this club for this year. So where we have like these weekly meetings, weekly presentations, you can drop by like anytime you want to be like, I think an official member, you need to come to like 4 club meetings or whatever. But if you just want to like drop in, that's also chill too. So yeah, that is the answer to that question. They recommended me going for learning how to cope. Oh yeah, of course. Yeah, I think that like the that's also another, I think, another thing that athletic trainers, and that's also one of the reasons why we have like sports psychologists, is sometimes athletes after they heal, they're kind of, sometimes they can be scared to go back into the sport that caused their injury. They're scared to be doing those things, right? So like, you know, like I think that's kind of a normal response. Everyone's kind of hesitant to do what previously caused them an injury. So yeah, there is definitely that mental component for sure. Do you have to be a sports medicine major? No, you know, I wish we had a sports medicine major. Where Davis is not that cool yet. No, you literally can be any sort of major to come in and check out our meetings. You can even, one of our previous sports medicine people was an English major, so literally you can just drop in. Yeah, we just hope you guys like find it interesting what the process was to get a sports medicine degree. Yeah, of course. So actually, so there's a lot of different fields in sports medicine. So, like you can be a sports medicine physician. So that would be the classic route of becoming a physician, and then going. So you would go to medical school, you would do some sort of residency, then you'd probably do like a fellowship in sports medicine. If you want to be like an athletic trainer, you typically would what is it, you would go to athletic training school. There's actually specific athletic training schools you can apply to, and then you can kind of work with like you generally, I think most athletic trainers will start off working with like high schoolers and then kind of work their way up. Some people, I think one of our AT fellows, I think, is going to actually start working with an NFL team pretty soon, which is really sick. So what about the internship? Like when things are back in person, how could I find out more? Yeah, so definitely please follow, like check out our Instagram. We're gonna like keep you guys up to date with the internship information. So I think that applications will I cannot guarantee this 100%, but they will most likely open up next year. So the only thing is just note that the application process is actually a few like month-long process. So like ideally, if you're a senior and you're going to be graduating at the end of next year, applying probably wouldn't be really useful. But if you are a third year or below and you're interested in applying to the internship portion of it to actually work with the athletes, the application will most likely open up next year. Yeah, perfect. Yeah. And so that website that Lily just sent in, that will have all the updates with the application. If the application for the internship is happening, it will be updated by fall. So, yeah. Cool. Thank you, Lily, for sending that in. Okay. Any other questions? Also, you can totally unmute yourself and like ask questions if you want to as well. Yeah, of course.
Okay, well, thank you so much, Harpreet, for presenting. I think we all really enjoyed it and I learned a lot too, so.
Thank you for having me.
Of course.